So today's session is on beauty, balance, and billions. And it brings a fabulous panel of women leading the way in Africa's beauty, health, and wellness industries. So before we begin, I'll call my panelists up and then they can introduce themselves. So Waitherero Gitu, who is the CEO of Uncover Cosmetics East Africa. And then we have Ota Akhigbe from Nigeria, who is the Director of Partnerships at eHealth Africa. Then we have Umahi Zuludi, who is the co-founder and CIO of DiaHub. And finally, we have Daisy Isiaho, who is the co-founder and Chief Product Officer at ZuriHealth. So, I was hoping we'd have a conversation, not just about trends, but really about power and meaning and responsibility, because along with power, resources, and access comes responsibility. So, before we begin, I'll invite all panel members to please introduce themselves.
Thank you very much, Sylvia. Good afternoon, everyone. My name is Ota, and as she said, I'm the Director of Partnerships and Programs at eHealth Africa. And primarily, my work revolves around leveraging technology and strategic partnerships to strengthen health systems across the continent in Africa. And essentially, what we do is we develop digital health tools and design programs and deploy them to improve health outcomes across the continent, currently across 29 African countries programmatically. And while doing that, we drive sustainable development. And while doing that, we also see the central role that women play in healthcare access, in healthcare delivery, and also in innovation. And so we have seen that it's very important when we empower women, we actually create a powerful engine that really promotes and improves our continent. And I'm so looking forward to contributing to this discussion. Thank you.
So really a very, very impressive panel. Yeah? So I'll start off with a very, gentle one. Yeah? So what's one trend or shift in beauty, wellness, health, because I think it exists on a spectrum actually, that's exciting you these days?
It's exciting to see the focus on Afrocentric products. Like right now, we have consumers looking out for products that have shea butter, for example. You do your pedicure and then they use shea butter to massage your feet, and it's nice. We have moringa, we have baobab, and people are actually looking for these things that are Afrocentric. It's something that's very exciting for me. And I mean, just to steer a little bit away from beauty, but even fashion, more consumers are looking for African-made stuff. I'm wearing a made in Nigeria suit, and it's really, really good. So I just wanted to add that. It's also very exciting.
It is, isn't it? Yeah. Okay, and I think we've talked about the trends and things that are exciting, but I think it also feeds to relevance as well. And I know you've touched on it a little, but I was just curious. So where exactly are we seeing innovations that are out there that reflect our own African needs? And not just important things, but things that are like really us. And is there any opportunity that you think just might be overlooked in the female economy that could help us, because things have to be useful, don't they? But could also, I guess, unlock wealth as well for whoever decides to make it. And that's on to you, Ota.
Such an insightful question. I think when we talk about innovation, we need to talk about it from the perspective of not just importing models and bringing it here, but actually creating things that are contextual to our local context and also solving challenges for the communities here in Africa. So, for example, we see this every day in the work that we do at eHealth Africa. We develop and design solutions, right? And if I were to give a practical example of innovation, I'll talk about an application we created called Planfeld. So for those people who are familiar with public health, we do vaccination campaigns for frontline health workers, public health teams. They have what they call vaccination campaigns, where they do a campaign in the community to let mothers know they're coming to immunize their babies. Before, most of these campaigns were done manually. So people would go manually to plan this house to house, count the number of people. But then, working with the community, talking with these people, we developed an application called plan felt. Simple, nothing complicated, because you have to be conscious that you're going to apply some of these things in low resource settings. And really, when we talk about innovation, we must be conscious not to exclude. So it must be something that is accessible to everyone. And now, something that used to take as much as 2-3 weeks to plan a vaccination campaign now takes less than 3 hours, in some cases, 30 minutes. So we talk about innovation. What else did we do? Apart from developing that application, we realized that almost 70% of these frontline health workers and public health teams are women who have very unique schedules, dealing with family, taking care of their communities, and also they have the rhythm around their schedule. So we created and developed these tools in a way that the protocols are amenable and flexible to their schedules, making it easy for them to use. Very simple. So bringing in something like that in a way that works for them, not punishing them to have to be forced to use a technology that is complicated and difficult to use. So when I think about innovation, that's something I think about. Another example is still on the topic of vaccination, is even logistics, supply chain around taking vaccine from one place to the other. We saw that there were a lot of mishaps in the way. Sometimes vaccines were thrown away because they weren't able to track. And we came up with a product called Vaccine Direct Delivery. And that currently ensures 100% of vaccines that go through that initiative are delivered. And the beautiful thing about it when we think about innovation is that it's scalable. It not only can be applied in regions in Nigeria, but can also be taken to other parts of Africa. So for me, when I think about innovation, it's something as simple as that. Thinking about the local context, the challenges there. In these examples, I'm talking about public health teams, frontline workers, making it easy for them, but something that they can easily talk about and it's scalable. So that's for the first part of the question you asked. For the second part of the question, you said, are there any opportunities that we're currently maybe missing or not be focusing on? I think I would say there will be huge opportunities in developing digital health platforms or digital platforms for low literacy, for lack of a better word, and non-English speaking African women. So, I come from an predominantly English speaking country. However, we see that reports show that over 60% of African women speak their indigenous tongue. So imagine that right now, most of the applications developed, most of the solutions created are for English speaking women. How about if we just imagine the potential of maybe an AI platform that is in Swahili or Fulani or Igbo or Hausa, and the uptake is incredible because they are actually women, and based on statistics, over 60% that speak in their indigenous tongue. I feel like if that is an opportunity that we can take advantage of, and there's a huge, huge potential for opening of markets. One, when we talk about money, there's a money side of it, because remember, we must think about sustainability. So the money side of it is it opens up doors for content creators, app developers, businesses that want to support such initiatives. And then even in terms of well-being, we're opening up opportunities for more women that don't necessarily speak English every day to get the information that they need to better their nutrition, maternal health, better their communities. So I think for me, it's when we think about innovation, we should think about context-aware innovation. Cultural intelligence is very key. Innovation for the sake of innovation is one thing, but cultural intelligence and innovation must work hand in hand. So that's what I would say. Thank you.
And I guess when we think about innovating and creating, the objective is to scale. So I think about Uncover Cosmetics, for instance, and your sunscreen for people that look like us. We're not ashy when we put it on. It works, and yes, Black African women need sunscreen. So I was thinking we'd open the floor, open the panel to the floor to see if anyone had any questions, ideas, thoughts, reflections to share with us. A few, please.
Okay, let me just stand so you can see me. So, my name is Pamela, and I'm very passionate about this topic. I am a personal trainer, and a wellness consultant. So I was very happy to hear the answers to the questions, and I'm also in alignment with most of the answers that were given. And I just wanted to say just a few comments, not questions really. Your health is your wealth. So if you don't take care of your well-being, there's not much that you can do. And what I have noticed for myself, I started a company called Mind Muscle Journey. So I'm not just a personal trainer. We are aligned with a life coach. We take care of your mental health and your physical health as well, because that's very important. If your mind is not in it, the physical part will not be a part of it, and you won't be able to pass that on to anyone around you, your kids, your family, what's not. And a lot of things that I've noticed and in the corporate world with some of my clients also is that we sometimes sacrifice our health, our wellness to gain wealth, physical wealth, in terms of money. And then what happens sometimes, unfortunately, this wealth that we have now gained can't buy our health and our wellness. So it's very important to prioritize your health and your wellness. That should be the number one thing. Like Daisy said, it should be a daily thing. It should be something like brushing your teeth. It should be something like waking up. Whatever you do, you should prioritize yourself first. Take care of you. Start with smaller steps. It's not something that's rocket science. Very small steps could be something like grounding, walking on the grass, bare feet. Things like that will contribute. Small steps would make a major difference in your health and wellness. So that's basically what I wanted to add to the wonderful discussion. And thank you guys for being contributing.
We had a question here. Thank you. First of all, very insightful stuff that you've been discussing. I wanted to know in your various experiences and industries, how, because we have all these things that, she talked about, the moringas, the shea butters, all these things that are available to us. How can we leverage that to create wealth for ourselves? We've got all these people coming in and getting all these raw materials out and coming back and selling to us, body shop built on all these wonderful African ingredients. How are we translating our own in that space to create wealth for ourselves?
Thank you for that question. I think for me, I would say, there are so many ways we can take, but I'd like to simplify it and just say focusing on two things. First of all, is a focus on quality. I think the reason why there is also an uptake on people wanting Afrocentric products is because the Afrocentric producers have upped their game. So first thing is, if we can put our mind on developing quality products with the materials we have, people would gravitate there. So for example, if we take the shea butter and we're a bit innovative in the delivery, maybe make it smell better, make it softer, fluffier, make it do a bit more, I guarantee you that when people use it, they will keep using it. I will tell my cousin and tell my sister. That's just at a very basic level. We talk about quality first of all. First. But secondly also is also the support, which ties into the previous panel. These entrepreneurs also need the support, need investment from people who have the funds on the continent. I mean, we have a growing organizations that are focusing on entrepreneurs in Africa, because it is that support that would give them more funding, more capacity, even in terms of patient funding, capacity building, guiding, and mentoring, to be able to scale the product, to be able to do a lot more. And that is where that economic might comes from. But I think at the very basic level is a mindset around quality. When we start with quality, match that with customer service, and then have the right support, then we can scale. And that is also something that is going to lead not only to domestic growth on the continent, but also exporting this to other continents as well.
I think when we look at the beauty industry in the continent,
Obviously, with skincare being predominantly, I think, the largest of the industries, just because it's a lot more diverse. But we're quite peculiar. We're quite peculiar. We import hair, huge amounts of hair. Actually, in beauty, we import the most amount of eyelashes. There's nothing wrong with any of those things. The question, though, I want to ask is why is it so difficult to set up manufacturing? Why is it so difficult to have, instead of having 15 small businesses doing the same thing, coming collectively together? You can't do research and compete with Lancome or Estee Lauder. We just simply can't because of skill. But when you have 15 of those, you can put your resources together and start to really do meaningful work. What's the barrier that makes it so difficult for us to be able to come together to make some of these things? Because the money is there. People are spending $400 million. The industry is like 325 billion. And yet, we're talking about, 10 million shilling turnovers. If we're lucky, we get to $1 million turnovers. What's stopping us? Why is this so difficult?
So just to quickly add, because in her question, she also said something very important, which is that collective vision. I think when we even think about the subject of innovation, it's even innovating our business models. So traditionally before, maybe one company has a mind and the back end and can do it by themselves. But we're seeing that now we're drawn towards competition, where you have your expertise, you have your capacity, you have your network, and we come together. She said 15 small companies. How about 10 of those companies come together and come up with a consortium and have a business model that works in a way that is fair and ethical? And there's so much more we can do. And in addition to what she said, because there's so many moving parts, we can't forget the government bit. But guess what? In that consortium, we would have one of the parties that knows the workings around the government, another party that knows where to get the fund from, another party that has the technology. By the time we do that together, I'm hoping we're seeing more of that now. I'm hoping that will drive more of that. So I just wanted to add that. Thank you.
So I'm very mindful of the time. So I think we'll take 3 questions. And the panel is here, so more conversations will happen after lunch. So let's invite a gentleman. Rise at the back.
Thanks a lot. My name is Tom. I'm from a startup called Neurolabs Africa in healthcare. So in radiology, specifically AI in radiology. And what we do is very simple: ensure that our moms, our sisters, when they go to hospital, they get their lab results immediately. When we have this conversation, it's very amazing, but just another line of thought, a struggle that we have had as well. So when it comes to, you mentioned several exits of wellness companies to bigger companies, but some products are dropped. So maybe you could wonder, maybe it's the data. So we all have different data points that we are collecting. So how do we aggregate this data? How do we give this data to a governance perspective, that this data can be used in the future to be able to develop another product that is centered for ourselves? So maybe that's why they drop our products, because of insufficient data to be able to keep them very well informed. So as we have these conversations today, the most primary question is, how do we prepare for the future of wellness? How do you prepare a future of this product getting to the third, fourth, fifth, and seventh generation? If we don't keep this data, if we don't have an aggregator of this data, we've mentioned about governments, we've mentioned about institutions, but if we build this community, then probably the next people in government, in leadership positions, in even Africa CDC are going to come from this network. So what do we go in mind with when it comes to how we bring our data to be able to make these products even global? Because we're competing with people with resources, like she has mentioned, we're competing with people who have good data systems and all that. And it starts from subsidizing some of these costs. You see, why DeepSeek was able to get where ChatGPT is, it's because of subsidizing costs. That's what the Chinese government did. So that's what I thought I should put in so that we could think about.
But we are making progress, I must say. I can speak from experience. So for us, we are data driven highly, and we do data mapping in northern Nigeria. Matter of fact, we mapped the states, all the states in northern Nigeria, working with the Nigerian government. Is there room? Obviously we need to, there's still more room, more things to do in terms of translating that data. But in terms of picking that data, cleaning it up, and working with the government, we are already doing it now. But I think the message is collaboration. How do we collaborate more so that it can help us with more decision making? Because when we think about program designs, which I mentioned, we design those programs from the data that we've collected. It helps us to make decisions around trends that we've observed. But I think the idea is making it scale across the continent and doing a lot more.
Thank you so much for such an insightful conversation. And thank you all for chipping in with your reflections and your questions. And of course, the panel members are available to have conversations and, collaborate with you.